Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullah. Today we are going to discuss an important type of hemolytic anemias occurring due to problems in globin chains, and these are called hemoglobinopathies. The abnormality in these globin chains may occur, number one, in the structure of the globin chain itself. So there is a substitution of one of the amino acids leading to change in structure. Number two may be reduction in the amount of one of the chains, either alpha or beta chains are reduced in amount. This reduction in amount will lead to precipitation of the other globin chain. As you know, we have two alpha chains, two beta chains. They combine or bind together. If there is a reduction of one of them, there will be the other one will be free. So if beta is reduced, the alpha chain is in excess, and it will not find the other beta counterpart to bind to it. So it will be free inside the cell, and it will precipitate inside the cell, causing its hemolysis. We start to discuss abnormality of structure. So synthesis of an abnormal hemoglobin structure. Some of these hemoglobins will be due to substitution of some of the amino acids, like sickle cell anemia is the most important example. Also, we have others like C, D, and E anemias. They are not uncommon, and the result is that synthesis of abnormal hemoglobins that are not freely leading to synthesis of abnormal RBCs that are not freely mobile and moving inside the circulation, leading to a sort of precipitation and occlusion of blood vessels, and also damage and hemolysis of cells. Unstable hemoglobins are rare and will result also in a way or a sort of chronic hemolytic anemia. So the classical example of abnormal hemoglobin structure or globin structure is sickle cell anemia. The abnormality is in beta chain. We have substitution of valine instead of glutamic acid at position 6. This will lead to production of abnormal hemoglobin called hemoglobin S. This hemoglobin S is insoluble and it forms crystals, specifically when get exposed to low oxygen tension, and this will lead to a sort of precipitation and occlusion of blood vessels, and also hemolysis of the red cells. So the red cells sickle and may block different areas of the microcirculation or large blood vessels, causing infarcts of various organs. It may be deceased. The patient may be deceased with homozygous inheritance, or may be heterozygous. When the patient is heterozygous, we have a carrier state. This carrier state is widespread and is found in up to 30% of West African people. And they think the widespread carrier state in African countries occurred in response to malaria infection, because it gives protection against malaria, because the malaria parasite, when gets into the RBCs, abnormal RBCs, it will be destroyed with the RBCs, especially in lower oxygen tension, and the condition is unfavorable inside the RBCs, so the parasite will not live and will die soon. So this will lead to protection against malaria in sickled patients or carrier states of sickle cell anemia. So we have two forms of the disease. We have the homozygous state and the heterozygous state. For homozygous states, assuming the abnormal hemoglobin S is S,